did this for several reasons. We now have the first confirmed case of COVID-19 in Miami-Dade County, and all indications are that we have yet to see the worst of this outbreak. This declaration allows us to take certain protective measures to ensure that our residents, staff, and visitors to Miami Lakes are safe, and the town is better able to respond to demands that a situation like this can place on local government. This declaration will allow me to waive certain purchasing and budget requirements to more quickly respond to the outbreak. My declaration follows similar ones issued earlier this week by Florida Governor Ron DeSantis and Miami-Dade Mayor Carlos Jimenez. As a result of this, I have ordered the cancellation and postponement of all large-scale public events in the town, as well as all programming and athletic events in our parks, effective tomorrow, Friday, March 13th. This order will remain in effect until April the 5th. The only program that will remain in effect for tomorrow, Friday only, will be the YMCA after-school care program at Royal Oaks Park and Miami Lakes Optimist Park. This program, however, will be canceled after tomorrow's program. We will continue to assess the situation and will revisit this decision if necessary and issue updates prior to April the 5th. We realize that this may place an undue burden on organizers, parents, and participants, but we felt that this was the prudent and safest measure to take. In addition, the Mayor's basketball challenge against the City of Doral has been postponed until June. Further information will be forthcoming from Mayor Sid and his office. Town committee and HOA meetings held in any town facility have been canceled through April the 5th. Town council and planning and zoning meetings, however, shall continue as scheduled. Residents are reminded that these meetings do not have to be attended in person and can be viewed online and on Facebook. In addition, we have the ability to receive public comments at any town council meeting remotely. All other town operations, including hours of operation for Town Hall, remain unchanged. Parks shall remain open for the use of our residents. The town of Miami Lakes is open for business. We have also implemented some more rigorous cleaning and disinfecting procedures at our facilities and are doing everything possible to keep them safe. In an abundance of caution, we do recommend that any resident or contractor that has business to transact with the town call or email the town or use the town's website or app first to see if their issue or concern can be resolved via the telephone or resolved electronically. For everyone's safety, if you do not need to visit Town Hall in person, please try to avoid it. If you do visit Town Hall, we ask the public's full cooperation in following all common sense guidelines for prevention, for the safety of the general public, our elected officials, and our town staff. Please avoid visiting Town Hall if you are sick or are experiencing any flu-like symptoms. The Freebie on-demand service shall continue normal operations. Freebie has stocked disinfectant and necessary cleaning products to disinfect their vehicles daily, having drivers wipe down all surfaces, handles, and touch points. Freebie has and will continue to stockpile as much disinfectant as possible to be prepared as they continue in the future. Any Freebie employee experiencing flu-like symptoms of fever, cough, and shortness of breath will stay home. As a precaution, Freebie employees are required to obtain a physician's note before returning to work if their absence was related to flu-like symptoms. Currently, town staff has activated emergency operations to a level 3. This is simply a monitoring phase. Our Emergency Operations Center is not currently activated. Please know that town is committed to keeping everyone informed as further developments arise. While we navigate this event and plan to ensure the town is doing what is necessary to combat the situation, there are steps you can take to reduce the risk of spreading COVID-19. Simple tasks as in properly and thoroughly washing your hands, utilizing hand sanitizer, coughing into your sleeves, avoiding touching your face, and if you are feeling ill, staying home to self-isolate. These actions, along with limiting unnecessary personal contact and practicing social distancing when feasible, will give us the best opportunity as a town to mitigate the spread of any potential virus. It should be noted that this virus indeed does carry a higher risk for the elderly and immune-deficient individuals. These recommendations should be highlighted in organizations and facilities which this population is denser. As we continue to gather more information and make it available, we encourage the public to visit the CDC website and the Florida Department of Health's website for up-to-date information. In addition, we have established a resource page on the Town of Miami Lakes website. That web address is Miami Lakes, altogether, -fl.gov/coronavirus. There you'll be able to find resources for our town residents with regard to the coronavirus outbreak. Now I'll welcome to, well, let me first, the Town of Miami Lakes Mayor, Mr. Manny Cid.
Just reiterating what our town manager said, prevention, 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 prevention. I mean, that's what we're talking about today, making sure that folks are doing the right thing. If you're coughing, don't come to town hall. You know, we'll work with you. We'll work with you remotely. If you want to talk to your town council, you can do it via the flat screens. But that is the main message today: prevention, prevention, prevention. We want to make sure, specifically, our most vulnerable population. We all practice prevention. Let's help them out. Let's not visit, you know, be it an ALF or a senior center or an event that you don't need to be there. Let's make sure that we practice that. Sanitizing all different surfaces where folks are touching. Sanitizing your phone, something nobody thinks about, right? Make sure you sanitize your phone because a lot of times carries a lot of germs. But the town manager did a great job explaining what our town is doing. But the main goal today is prevention, prevention, prevention. We're going to lead by example on the city council. If there's any council members that are coughing or whatnot, we have the capability to participate in every single one of our meetings remotely, and that's something we'll be doing. But we want to make sure the public understands that you can do that also. We're trying to work with our building department and different departments to make sure that there's that type of participation going on. So I'll hand it back to our town manager to address any questions that you might have. But again, it's all about prevention. Let's make sure that we work. We're all in this together. This virus doesn't look at us being political parties, being from living in this city or that city that doesn't believe in borders. So we're on all this together. Let's make sure that we work together, and prevention is the key to making sure that we surpass this virus, which I know we will as a community together.
Yeah, I also want to make note that we also have with us Councilmember Joshua Diegues. We have our Vice Mayor Nelson Rodriguez and Council Member Luis Collazo, and some of them may want to make some remarks.
Listen, as a healthcare provider, I encourage you guys to continue to wash your hands, like the mayor said. But as changes come with the schools and activities being canceled, this is the time to watch out for your children. Watch out for those children playing in the street. Although we try to get them to isolate, they do get hyper and they want to go out there and play. So watch out for the children in the street as some of these programs get changed and canceled and postponed. There's going to be an abundance of children out there. So just slow down. This is not the time to panic. This is, you know, a flu-like virus, and proper prevention, proper hand washing is the thing. But watch out for those children out there as more of them, more events get canceled throughout the county, and they're out there in the street playing because they do get bored at home. So just be careful.
Thank you. In a few minutes, we're also going to be convening a public meeting to address the most vulnerable populations in our community, which are the adult daycares and the adult living facilities. The governor issued an emergency order yesterday that actually gives the authority for certain facilities to take measures restricting visitors and restricted people who have been possibly exposed to COVID-19. We're going to be highlighting some of those emergency orders from the governor, and also, again, as the mayor said and the manager said, best practices and common sense are still the word of the day. So we will continue to focus in on the most vulnerable, which are seniors and places where seniors congregate. Thank you.
Any one of us are here and available for questions. At this time, we're not aware of any cases in Miami Lakes that are either suspected or confirmed.
We have 3 licensed adult daycares in the town of Miami Lakes, and I think we have 18 at last count, 6-bed facilities, but don't quote me, I'll make sure that we have the accurate number. I personally made contact with at least a dozen of those yesterday, reaching out to them, making sure that they had the correct information. Some of them are going to participate today in the webcast. Some are actually gonna ask questions. We have materials which I know the town clerk has received that have been distributed by the Department of Emergency Management, and I also have copies of the executive order that was issued by Governor DeSantis advising them of the new visitation requirements. Correct. Limiting visitors, in particular in areas that have been exposed or have COVID-19 has been tested positive for, and best practices on how to limit the entry of that into the facility, not just with visitations, but also vendors.
If someone thinks they have the symptoms, should they call the fire department? Should they go to the hospital? What would you recommend?
It depends on the severity of the symptoms. If it's something that's emergent, life-threatening, obviously 911 is always there, thank God, and they have in the town of Miami Lakes, they have a great response times, especially now that we have a second rescue station that's in the town. If the symptoms or the signs are more subtle, they should consult with their primary care physician and then follow their guidance. If it happens in the middle of the night after normal working hours, please seek care in an emergency room or an urgent care center.
And you had said earlier that you may review how things stand before April 5th to determine whether you'll end the quarantine, for lack of a better word, on April 5th, or if you'll cancel it earlier. Is that?
Yeah, several days before the expiration of the order that I've listed today, we're going to reassess the situation and see if that order to postpone our programs and close our facilities are going to continue, or if we're able to now lift that order and we're going to be able to come back to some semblance of a normal schedule.
And have you had any notice from schools yet on their plans?
No, we got word, unofficial, that they are not planning to close tomorrow. We had originally heard that they may close tomorrow, but right now they're under normal operations, the school board. That's the last that we heard from the school.
So they may, is the last that you heard, or they are?
No, I believe that they made a decision that at least tomorrow, classes are still going to be in session.
Will be in session?
Yes.
Okay.
And I just wanted to, because we made several mention of the elderly population, together with our police officers helped us go to the ALFs in the town, and they provided information with regard to hygiene, the importance of hygiene, and a lot of that type of information to the care givers in the ALFs and to the patients themselves. And they're going to go back and go a second time back and make sure that all is well there.
Families, mothers, folks that that are afraid right now.
Yeah, if I want to put it in a nutshell, I believe that the true message is we have to act similar to when an approaching storm is coming. It's prudent. We have to take the proper measures, but this too shall pass. We cannot be complacent, but we can't overreact. This is not, the end of the world. We are taking the necessary steps to mitigate this as much as possible, and people need to just take like the mayor and the council member Collazo mentioned, and the vice mayor, the common sense approach and that will dramatically improve, and what they keep talking about, flattening that line of the number of cases, and that'll help and go a long way towards making sure that this outbreak is as minor as possible.
More proactive and just not waiting around.
Well, I'd like to think that we have, as you could tell, our elected officials are a young, energetic bunch. Our town staff is similar. So I'd like to think that we're not reactive. I'd like to think that our town staff and our elected officials are very proactive, and we always believe that we're going to get better results by getting ahead of issues instead of blinding ourselves and always chasing it. So I believe that we do have a proactive approach, and we're not afraid to get ahead of it.
Speaking of panic, you may have seen on social media the long lines extending out of Costco toward the gas pumps. People, power shopping. Is that necessary? What would you tell people who are blowing their budget on?
Yeah, I don't think it's necessary. I think that, there are a lot of other options, whether it's the delivery services from the supermarkets and things of that nature. I don't think that it's necessary. But this, I think normally, and it's similar to when people are preparing for an approaching storm, that panic lasts for a few days, and then it kind of wears off. And then they're looking to see, what am I going to do with all this water or all this toilet paper? So I think that this rush will only last for a few days, and then I think more and more people will start going back to a normal frame of mind and a normal purchasing trend.
I do want to add one thing to that comment. I do want to add one. I'll use the remote mic. I do want to add one thing to that comment. By people doing that, it's actually creating another issue. And then those places that actually have vulnerable populations that need the supplies are not getting it. So we do have supply and demand issues right now. So the places that do need the disinfectants, the washes, because they care for those vulnerable elderly, they don't have that availability because people are panicking. So prudent, again, use common sense, but at the same time, realize that we have a great need out there, and just use common sense when you're purchasing.
Yeah, just to piggyback on that, I spoke today to an assistant chief with a local fire department, and even the fire departments who have direct connection and a direct pipeline to supply houses that deal with medical supplies, they are having delayed delivery of supplies, masks, gloves, etc., that they are in need of, and they're the caretakers, the emergency responders, the first responders. They need to have that care, and if people start hoarding those kinds of supplies, it will create a need where it's most needed.
Hello, good afternoon. Danny Deverona, president of the Optimist Club of Miami Lakes. Earlier, you discussed that the cancellation of organized sports events in the town. What I'm hearing a lot of the members are asking me is, what about small-scale practices at our parks, individual teams, things like that?
Yeah, I mean, the parks are going to be open. So if Dad wants to go kick the soccer ball around with Johnny, the fields are going to be open, and we're not going to restrict and close off the actual fields. So if they're not going to be organized practices, they're not going to be reservations, but we're not going to keep people from going out there. People are eventually going to get cabin fever. So if there's going to be self-isolation and even quarantine, we're going to need people. People are going to look for an avenue to get out, and so we're not going to close the actual fields, the parks. So if people want to go out there and throw the baseball, the parks are still going to be open for that kind of stuff.
Has there been any discussion with our federal or state governments about getting some of these testing kits available and setting up drive-by testing stations for the virus, at least as a screening tool? The town of Miami Lakes did a great job with the sand disbursement during the hurricane. The exact same thing could be set up as just for screening. Now, there's two types of tests. There's one is called an ELISA test, which is a general screening for coronavirus. And then if it tests positive, there's now a second test, a PSR test, to go ahead and determine if it is the same virus. Is there any discussion with those tests becoming available?
We have not entertained that. Most of the testing is being done in a medical facility. It's not being done whether through EMS. It's not being done in a public building like this or a park or what have you. Right now, all the testing is being done through a medical facility, and it's being handled that way. So no, the answer to your question is we have not entertained that discussion. We haven't found the need.
Mr. Manager, the issue did come up during the emergency management meeting where Maurice Kemp was officiating, and they're trying to discourage the public from coming to a central site for that type of testing because of fear of spreading the virus. Yeah,
Yeah.
they're trying to discourage people, if you have the flu-like symptoms, they are advising people to contact their healthcare provider. The healthcare provider will then put them in telephonic contact with a special number from the Department of Health, and then the Department of Health will continue the monitoring and screening process telephonically.
Any other questions from the media? All right. Thank you very much. And obviously, we'll be here. If you have follow-up questions, you have my email or contact info. We'll be happy to answer the questions after, even after later.
Afternoon, everybody. We're going to get started because I know you all got to get back to work and you're all very busy, but I appreciate everybody coming out in such short notice. We want to bring everybody together specifically to talk about prevention and talk about what the town is doing. We have some epidemiologists from the local health department here with us today who are going to have a presentation, and we have different folks, like we have Chris Garcia from Station, one of our first responders. He's going to be available to answer questions from Station 1 right here. Our vice mayor, and we have Vanessa Villamil and Stephanie Gaia with us from the Florida Department of Health. They're both epidemiologists, so they are experts on what we are dealing with, which is COVID-19. We also have Councilman Collazo, who we're very fortunate to have him on the city council. He runs a statewide association on ALFs, FALA, correct? And he's also on the work group for the county, so he's going to provide some great information. We have our deputy town manager, Tony Lopez, our deputy town attorney, Lorenzo Corbier, our town manager, Ed Peterman, our town commander, Javier Ruiz, and our town attorney, Raul Gastesi. This is also being broadcast on our website live, and it's also being archived on Facebook and on YouTube to make sure that people go back and watch it. So once we do the presentation, I want to encourage everybody to ask questions. I heard from one of the providers yesterday, and he was sharing some of the stuff that they're doing for prevention in their facility here in Miami Lakes, and I want to make sure that we're all on the same page and we all have the same information, and we can fight this together, and I'm sure that we will prevail sooner rather than later and get on the right side of this. So I want to hand it off to Vanessa and Stephanie. They have a presentation for us, and welcome. They are the experts, folks. So I know there's a lot of stuff going around on social media, on the news, and this and that. The experts on the epidemiologists are here with us today. So after the presentation, we'll be going around passing the microphone. Please open it up. You got everybody up here, so take advantage. You got all the decision makers, first responders representing the fire and police. So please ask questions, share your concerns, and share your thoughts. We recently just signed off on a state of emergency here for our town, meaning we're going to be eligible hopefully very soon for some dollars to work with you all and work with the community on prevention. So Vanessa, Stephanie, welcome. Whichever, you could either or. Do you have, no, pass that one.
Okay, this is fine. Hi, so I'm Vanessa. I'll start off the presentation with some background information. Can you, oh, okay, sorry. Okay, so to start off, so coronavirus 2019 was first detected in Wuhan City, Hubei Province, China. Cases had symptoms of respiratory illness that were unexplained by anything else. They were linked back to a seafood and live animal market. This suggests that it was spread from an animal to a person and made that jump, similar to other novel coronaviruses that have spread from camels, cats, and bats. There is person-to-person spread happening, and it continues in other countries, including the United States, as you all know. So these are our most up-to-date numbers. Worldwide, we've seen 127,863 confirmed cases and 4,718 deaths as of when I updated it right before leaving. We don't get these numbers from the CDC because they're kind of on a delay, so we get them from other sources. This one is from the Johns Hopkins GIS map, as well as because states are reporting live in real time. That's why we're not getting the numbers directly from the CDC. These are a little more up to date. So in the United States, there are 1,197 presumptive positive cases. 46 cases are from the Diamond Princess, 21 cases from the Grand Princess, and 3 cases repatriated from Wuhan, China. There have been 38 deaths so far. In Florida, there are 36 positive cases and 2 deaths as of when I updated this presentation before leaving the office. So this is a brief timeline. I'll just highlight that as of March 11th, the World Health Organization did declare the COVID-19 a pandemic. So COVID is most often spread from person to person. It's spread through respiratory droplets from an infected person who coughs or sneezes, and it's spread among close contacts, which is defined as being within 6 feet for a prolonged amount of time, or being in contact with the respiratory droplets. So it's not necessarily just one or the other. The symptoms can appear 2 to 14 days after exposure and include fever, cough, and difficulty breathing. To prevent this infection, you can follow routine respiratory disease prevention measures as for all other diseases. Wash hands with soap and water often for 20 seconds. When that's not available, you can use as a substitute hand sanitizer with at least 60% alcohol, but it's preferred that you wash your hands with soap and water. Avoid touching eyes and nose and mouth, and avoid close contact with sick people as much as possible, and stay home when you're sick. Oh. So people that are at risk of maybe having been exposed and are having symptoms of fever, cough, or difficulty breathing, they should call ahead to their healthcare providers and tell them about any travel or exposure they might have had, as well as their symptoms. Avoid contact with others in the meantime and do not travel. Cover your mouth, nose when coughing or sneezing. Wash hands often with soap and water, like I said, for 20 seconds. And then practice environmental cleaning, disinfecting frequently used surfaces. If a mask is needed because you're having symptoms, it's critical to follow the best practices on how to wear these and remove them and dispose of them properly, as well as practicing hand hygiene after removing them. So currently there is no specific treatment for COVID-19. All the treatment is supportive of symptoms. Severe cases are treated to support their organ functions. The CDC developed the test for COVID-19, and that's what we're using at the Department of Health, Public Health Laboratories to test. As of this week, commercial labs can also test for COVID-19. They're not required to meet the same criteria as we are. That's more at the discretion of the physicians, but they are still receiving recommendations from us on when to test. So if a case is suspected or confirmed of COVID-19, they should immediately isolate at home or a healthcare facility, not participate in public activities such as work or school, only travel by ambulance or a private car if they are suspected or confirmed. They should avoid public transportation or even ride sharing like Ubers or Lyfts. They should always wear a mask when around other people or pets, and always cover their coughs and sneezes and clean their hands often. And as well as practicing, again, re-emphasizing practice environmental cleaning as well. Don't forget that one. And then I'll hand it over to Stephanie to go over the travel advisories.
Okay, so some travel updates regarding the novel coronavirus. It is recommended that travelers from affected areas who are sick delay or avoid travel. General recommendations for personal hygiene, such as the ones that Vanessa has already mentioned, hand hygiene, cough etiquette, and keeping a distance of at least 6 feet from individuals that are showing symptoms remain particularly important for all travelers. So for travelers that visit level 3 designated areas, and I'll talk a little bit about what that means. The CDC recommends 14-day self-isolation and social distancing upon return to the United States. Social distancing includes avoiding going out in public and close personal interactions. If you become symptomatic, immediately self-isolate and contact your healthcare provider as well as the county health department. For level 2 travelers and for travelers on cruises, the Department of Health and the CDC recommends that those travelers should monitor their health status and limit interactions with others for 14 days after returning to the United States. So there is a Nile cruise advisory as well for individuals that were who traveled on a river cruise on the Nile River in Egypt in February 2020. The recommendation is to self-isolate for 14 days following their date of return to the United States. There's an additional advisory for individuals that had recently traveled through Port Everglades. If you were experiencing, for those individuals, if they're experiencing symptoms, they should immediately contact their healthcare provider as well as their county health department and self-isolate for 14 days. Employees of Metro Cruise Services at Port Everglades with any association to the 3 positive cases should self-isolate at home. So the CDC travel advisories consists of countries with sustained community or widespread transmission, and right now those are designated as China, which is the level 3 that I mentioned earlier, Iran, also level 3, South Korea, also level 3, Italy, which is also a level 3, and Japan, which is a level 2. Right before leaving the office, we were informed that several countries in Europe have now been put on this level 3 travel advisory. And that information, it's a longer list of countries, but that information is available on the CDC's website. So this, we just wanted to show is an example of information that the CDC provides to travelers. It's a health alert consisting of instructions on what to do. So what to do when they return to the United States, what symptoms they should be monitoring for, how long they should be monitoring their symptoms for, and what to do if they do develop symptoms or if they need to seek medical care. And then now we're going to go into what we're doing here in Miami-Dade County. So the Department of Health, the Florida Department of Health is monitoring those possibly exposed. And this is occurring at all of the county health departments. There's 67 of them in the state. And we're working with the central office in Tallahassee to protect Floridians from emerging diseases such as coronavirus, the novel coronavirus. So the Department of Health receives information from the CDC on U.S. citizens, residents, and family returning from impacted areas. And the local county health departments are working with travelers to restrict their movement, monitor their illness, isolate persons with symptoms, and ensure healthcare providers use proper infection control techniques while caring for symptomatic individuals. So what does the DOH monitoring process look like? For those individuals that have been exposed but do not have symptoms, we recommend monitoring for symptoms for a 14-day period. They should also self-isolate for those 14 days, and that means that they should stay home as much as possible, avoid travel on publicly used vehicles, gatherings with groups of people, and going out in public. They should be excluded from work, school, and other public places. And then they should also follow provided education on prevention of the spread. As far as the immediate risk to Americans, it remains low. So even though more cases in the United States are likely to be identified in the coming days, this is again due to the increased availability of testing at the commercial laboratories. So we're expecting more cases to be identified. Still, there's currently limited person-to-person spread in the community, but as everything with this virus so far, this may change. And as this information changes and more information becomes available, we will make it public to the community. Everyone can do their part to prevent the spread of COVID-19 and other respiratory viruses, and that's again just following the same transmission prevention techniques that Vanessa was talking about, practicing frequent hand hygiene, avoiding contact with individuals that are sick, staying home if you're the one who's sick, seeking medical care when needed, but also calling ahead to your provider to make sure that their facility is equipped to receive you, and if not, what they recommend that should be done. And also practicing cough etiquette and disinfecting surfaces as often as possible. Next. All right, so as far as websites that you can access to learn more about what's going on, as I said, this information on the virus and what's going on globally, nationally, and at the state level, and even at our county level, everything's changing constantly. So if you, for our state, the best resource to use is the Florida Department of Health website. And you can, you don't have to memorize that long link at the bottom. What you can do is just look up in the search engine FDOH, so Florida Department of Health, COVID-19, and it should be the first option that pops up, as you can see in the left picture. And on the right is just a snapshot of what our main COVID page looks like. And that's giving you information on how many cases have been identified, the how many cases are being monitored, how many tests are pending results, how many have come back negative, all of that information. And if you scroll to the bottom, you could even see which counties those cases have been identified in. But it also, on the left hand of the website, it has several resources that link to the CDC's recommendations for different facilities, such as schools, businesses, healthcare facilities, information for healthcare providers, many resources that can be used. And we're also putting, like I said, we're updating this daily, or the state is updating it daily. As information comes out, we make it available to the community through our website. And then this one's just, again, this is the CDC's webpage. Yes. Again, to search the CDC's page on COVID-19, all you have to do is in a search engine type CDC COVID-19, and it'll pop up. It should be the first option. And again, the pictures just kind of highlight certain sections where you can find information. But if you go on their page, again, they have multiple resources that you can use depending on what your situation is. And you could always find a lot of information and up-to-date information of what's going on at the national level. I also wanted to point out that the Florida Department of Health has a hotline. It's the 866-779-6121, which is a dedicated phone number that residents of Florida can call for more information on what's going on with COVID. And you can also email that email. It's listed there, covid-19@flhealth.gov. If you want to contact the Florida Department of Health in Miami-Dade County, our number is at the bottom there. That's the 305-324-2400.
All right, so we're here for you guys. We want to hear what your concerns are, how we can work together, how we can share best practices. Anybody here can jump into the conversation. I don't know if anybody wants to break the ice. Joseph's going to walk around with the, just raise your hand, and whoever here wants to jump in. I know Councilman Collazo has personal knowledge as to what's going on. And anybody here can jump in. Go ahead.
Good afternoon. My name is Miriam Duman. I work for Hialeah Miami Lakes Adult, and I run the senior programs here in the town of Miami Lakes, as well as the city of Hialeah. My concern, I got the email indicating that you will be closed until April 5th. I believe that's the date that it's said to come back. Now, I worry not only about this, but I also worry about the seniors going into depression, being out of their programs for such a long time. So I can see next week, I see that, and also the week after that, we have a spring break anyway. If we could go and revisit prior to April 5th, prior to March 30th, and say, well, we need an extra week, we can contact the students and tell them, listen, the teachers can talk to them and get that anxiety that they would have being out 3 weeks. We're talking about students that go to the exercise, Tai Chi class, they're adults with disability. So I worry about that as well. So is there any way we can, instead of predicting a comeback of April 5th, if we can just, deal with that and mention March 30th, and then just before that we can call, then we revisit, and if need be, then we take another week. I don't know, what are your thoughts on that?
I'm not sure if you were here when I was making my, my remarks to the media, but our plan is, right now we wanted to draw a line in the sand and have a date, and that date is April the 5th, because it goes through a weekend. Sometime before that, and it will probably be near the beginning of that week, we're going to reassess where we are. We don't know, right? We don't know if has it peaked yet? Is it on the downslope? Is it still on the upslope? So earlier in that week, we're going to reassess, and we're going to be reassessing constantly. And at some point, we're going to make the decision, and it won't be from one day to the next, because that's not fair to the providers and the participants and everything. So we want to reassess several days in advance of that April 5th deadline. and then decide whether it's safe to reopen all the programs and start them back up, or are we going to extend that April 5th date?
Okay, so as I tell the teachers, and they'll be calling the students, should I go ahead that to think about it may open, I won't say it will, it may open the 30th, but it will be, will be
Yeah, I can't really tell.
reassessed before that.
I don't want to tell
Without
people what to
giving a
do.
date, an
But
exact date.
if it were me, I'd rather leave it at April 5th because I don't want to cause more confusion than all of this whole, dilemmas already provided. So that's why we wanted to say a date specific. So we say, okay, April the 5th. Now internally here, our command structure with the elected officials, we're going to be continually revisiting this and looking at the date and looking at what's happening in the community, looking at what's happening with the outbreak, and several days before that April 5th deadline, we're going to make a decision whether after April 5th it'll be ready to go and
It may not
restart.
be April 5th, it could be even later than that.
Right.
You never know. So that's why setting up a date of April 5th, it may not,
We just wanted to
reasonable
have,
date.
we wanted to give people a horizon, some date out in the future that people can plan, people know, have an expectation. We thought it would be unfair to just say it's going to be day to day or have it open-ended. So we wanted to have some horizon, some date out there in the future that people can say, okay, April 5th right now is my target. Internally, we're going to be reassessing it constantly. And several days before April 5th, we're going to make a decision whether after April 5th we're ready to get started again or we're going to extend that, the cancellation.
okay, I just don't want the seniors to start getting into depression because that would be, I don't know what's worse, they go into depression and Councilman Collazo know about seniors as well as I do, too long with them, working with them.
So yeah, I'm going to hand it over to Councilman Collazo because he has intimate knowledge. And a lot of you guys, ALFs, senior centers, adult daycares, he can give you guys a quick update on everything that's going on, not only here in Dade County, but statewide.
Thank you, Mayor. And Miriam, I'm going to speak to that point specifically with regards to seniors and community-based service providers, and then I'll go into a little bit more detail to adult daycares and nursing homes and assisted living facilities, but in particular, the Department of Elder Affairs, which is the people who operate the services for seniors throughout their county. It's the area agencies on aging, and here it's called the Alliance for Aging. Received notice that they will start shifting their funds from the seniors that used to congregate, like at congregate meal sites, and will now start doing home-delivered meals. So the most vulnerable populations that would congregate in these adult congregate meal sites will now start seeing we'll start seeing now the provision of services for home-delivered meals because many of these seniors depend on these meals for their livelihood, not just, this is the only meal that they have, the only access to meals that they have. So we received notification that the Department of Elder Affairs would be shifting. I spoke to Chastity, who was here, and I spoke to some other elected officials at the state level that would be advocating to see what else can be done. So maybe that's another opportunity, maybe calling those seniors that are now being asked to self-isolate or be at home and make sure that they have some contact with the outside world. And that might be something that we can shift gears on, right? So as certain types of places shut down, maybe their roles can be re-identified, and I'll bring that forward in the state and make sure our state partners are aware of that suggestion. So thank you. Specifically, the governor issued a state of emergency yesterday, in particular for nursing home providers and assisted living facilities. In the town, we do not have any nursing home providers, but within the town limits, we do have, I believe, 17 assisted living facilities. These are literally your house next door. They're literally small residential homes in any given neighborhood. We have 17 of those, and they range from 6 to 8 beds. Those facilities have been asked under emergency order to not allow certain types of guests into their facilities. In particular, anybody who has been infected with COVID-19 who has not tested negative twice. So 2 negative tests. If you've been infected with COVID-19 and you cannot produce 2 negative tests, you have been asked by emergency order of the governor not to visit any assisted living facilities. Anybody who's visiting an assisted living facility or nursing home that's displaying any signs or symptoms of the flu has been asked to stay away from assisted living facilities. Anybody who's come into close contact with someone who's been diagnosed with COVID-19 has been asked to stay away from assisted living facilities and nursing homes. Anyone who has traveled internationally has been asked to stay away as well, or anybody who has taken a cruise ship has been asked to stay away for at least 14 days upon their return. In any areas where there's been confirmed community spread, and the Department of Health can speak to what areas have been confirmed community spreads, but any area that's been identified as confirmed community spread of COVID-19, they are asked to not visit assisted living facilities. Again, this is to maintain our most vulnerable senior populations from being cross-contaminated. And obviously, anybody who's currently infected with COVID-19 or has been confirmed as a case of COVID-19 is not to be in any assisted living facilities. So recently, our police department has gone out and visited all our local assisted living facilities, and I see some of the providers here and our adult daycare centers as well, giving them information which has also been posted outside. The information that we have been sharing has been information that's been provided by our Department of Emergency Management in Miami-Dade County. One particular piece of information which I have here with me are the handouts, which are just continuing to practice sound hygiene. It's actually a graphic. It's very simple to follow, and it can easily be posted at any assisted living facility within the town. The other are the symptoms. It's also English, Spanish, and in Creole. It can easily be posted. We recommend that you post these in your facilities so your employees or your residents in the facilities have access to the information. But the part that I found most useful is this decision tree. Decision tree also includes the Department of Health. This is an algorithm that's currently being distributed by the EOC. So assisted living providers say, well, what do I do if I have a symptom, if I have somebody displaying symptoms? This decision tree will walk you through who you need to contact. I think the Department of Health alluded to it earlier. Make sure you're letting your provider know if you're going to receive services that you're calling in ahead of time. But it also provides the 305-470-5660, which is the Department of Health's number to also report, and so they can monitor and track the case. I can answer any questions regarding this or any other questions that you may have. Yes, Dottie.
Yesterday, we had 80 seniors in here playing bingo, and we took every precaution we could. Meraki came out. They gave out hand washes, and they had a sheet telling them how to wash their hands. They spoke with every single senior there to educate them, and I'm like her. When they are going to not have that activity, we're going to have a lot more problems, because I just seen them. They haven't had a bingo since last September. Oh my gosh, yesterday was like Christmas. So I think that we need to think about, I've been trying to write my brain, what can we do? I'm going to call some of the ones that I know really need some contact, but there has to be something that we can put out. Not all of them have Facebook or have an iPhone or anything like that, and those are the ones I worry about the most. So if we can come up with something, that would be great.
I think you're both onto something. The social isolation does take, just like we have very vulnerable seniors, I think with social isolation, they're going to take the hardest hit on this as well. As certain agencies start maybe shifting their focus, and I know we have some adult daycares here, if you guys start taking different positions on how you shift your operations, because I know you have concerned families and residents maybe not wanting to go, there may be an opportunity for the state to step in and maybe reassign those dollars to other agencies to provide other functions. So I know that was an issue that was raised, that's going to continue to be raised at the state level. We will look to the Alliance for Aging, which is our area agency on aging office. We already know that they've shifted some of their capacity to provide home-delivered meals to these seniors that are not going to be able to get them at congregate meal sites. And I think the adult daycares play a very important role in that as well. As many seniors, that's the only place where they go to have social interaction and have meals. Maybe we can see how we can partner with them to provide services, either phone calls or follow-up services at home for those seniors. Correct.
Robert Alonso from Always at Your Side Adult Daycare. I had reached out to the mayor earlier this week because I did speak to the state concerning some concerns that I had. I'm lucky enough to stand in Costco for 2 hours and purchase supplies, but we have a lot of seniors in our community who don't have the ability to go to Publix or to Costco and stand for numerous hours trying to buy supplies. We also have a lot of people that are stockpiling supplies that don't really need it. The segment in our community and across the world that is suffering are our seniors, and they're the ones that are harder to get those supplies to. So when I reached out to the state and mentioned that to them, they said that the state itself can't distribute supplies or anything to there. But I always remember, when a hurricane comes by, all of our elected officials, our police officers are out distributing water and ice cream and the whole works. Well, what are we doing to distribute supplies out to all of our seniors that are in their homes right now that might not have water, that might not have antibacterial, or might be running out of those supplies? You go to Publix or you go to anywhere, they don't have any more of that either. I know it as we sign our declaration of emergency for the town, we now could possibly tap into some federal reserves, if there are any out there, to get some of those supplies and distribute them out to our seniors. From an adult daycare perspective, we have the supplies that we need. We've been prepared for a situation like this. We always have high sanitation and encourage that, but as our members start going home, we fear what's going to happen to them and will they come back, from a social side as well from the health side. And we have to keep an eye on that population. So my question to the town is, what can we do? And whatever we can do, we'll help you guys out as well. But what can we do to get those supplies to our seniors?
Thank you, Roberto. The issue was brought up during our task force in the Miami-Dade County. The biggest issue that we're having right now, and it's not just the adult daycare centers, I'm going to tell you, every healthcare provider right now is in a crisis. We do not have the supply to keep up with the demand. And that's the reality of the situation. So when you see the shelves are empty at Publix, they're also empty at Medline, they're also empty at all the traditional suppliers that supplies hospitals, nursing homes, assisted living facilities, and centers like yours. So supply is an issue right now, and it's an issue because the general public has gone into panic. And because the general public has gone into panic, the most vulnerable populations are not getting the supplies that they need. So a word of caution. Try not to hoard. Try to be considerate. There are people out there that need it, like you said, our seniors, our adult daycare providers, our assisted living facilities, and our nursing homes right now that are caring for the most vulnerable need the supplies. So with that being said, they asked us that the supply management is going to be operated by our emergency operations centers. Right now, earlier this morning, I placed a call to the chief trying to prioritize the services or the supplies that nursing homes and assisted living facilities will need. But you brought up another very vulnerable population. What happens to those seniors when we ask them to stay home and isolate? How are they going to get supplies? So I think it's another great opportunity to go back to the state and to ask the Department of Elder Affairs to see how, when they shift the functionality of some of these service providers, like they've done with the home-delivered meals. Have they shifted from the catering services that go to the comedores, and they're now shifting to home-delivered meals, if there might be an opportunity to shift that supply distribution around. So I think that's some advocacy work that we can do. Maybe we can join together in making that ask of our state partners, but you're bringing up a very solid point that is an issue. And as further down the road, right, if this continues to expand, which we're not at that point yet, but as we're asking people to self-quarantine, healthcare providers like assisted living facilities and nursing homes and even maybe hospitals might have labor shortages, right? So that's another issue we may need to confront in the near future. We're not there yet, but it's something that we need to be cognizant of. Yo sé que hay alguna gente aquí que hablan español, ¿no? Si hay algunas preguntas en español, también hablo español. Si tienen algunas preguntas que le puedo preguntar, si tienen algunas preguntas que le puedo contestar, también hablo español.
To the point that was made earlier, the town already has services that you contract for seniors that come to an area. Part of what we're thinking the daycare is using our staff to go visit and check in on seniors. Could we repurpose these teachers to go out and visit seniors and check in, especially the ones that we could put in we can maybe create categories of our high risk, medium risk, low risk, the ones that don't have family. Are we checking in on them? The same way we check in, I think we have that list for the hurricanes, where we have, folks that we check in on, and it doesn't have to be senior, it could be somebody who is handicapped. So could we use resources in our town that are not going to be used for the next couple of weeks because they're shutting down the services to visit them? Same way that from the adult daycare standpoint, we're working with the state to go visit our adult daycare family members at home to deliver them meals and so on.
I know the town has already initiated some safety checks using our resources through the police department. I'll let the town manager talk about how he can reshift or reprioritize some of those resources if we want to start transitioning into that type of safety check. I think you have a very valid point in looking at our aging provider network and seeing how we can refocus their efforts. And I'll let the manager speak to the town resources.
Yeah, that's a great idea. This first blush, this first round of cancellations was like a wholesale round, right? So everything is canceled. Now it'll give us an opportunity to regroup, to take a look and obviously continue to monitor the situation. And now we'll be able to regroup and say, is there a different way that we can continue to serve these populations? And we'll address that. And we'll strategize and see how we can do it based on the contracts that we have and see if we need to modify them somewhat. And we'll start taking a look at that. But we wanted this first round of cancellations to be a wholesale round where it wasn't overbearing as far as how long it was. And now we'll take the opportunity to take another look and see if there's a different way that we can continue to help these different populations, whether it's special needs or elderly or whatever.
Hi guys, good afternoon. I'm Lindsay Wallach from Meraki. We were here yesterday giving out the hand sanitizers, and I know that a lot of the agencies, especially like Rosie with their labs, and I would be willing to have, counselors go and check up. We could have a team force, and we would be willing to cooperate when it comes to that.
I want to make sure that we reiterate if there are a lot of contacts that we're encouraging people to do by phone and by non-human to human contact. So I want to make sure that we're sending out the right message as well. There are telephonic contacts that we can do and make sure safety checks on those seniors and telehealth, right? So I think there was actually, I'm not going to misspeak, but I believe that there were some emergency orders giving certain types of providers the ability to now start doing telehealth, and I think that was part of a different approach that was being taken on by the Florida legislature as well. I know that there was a couple other people that wanted to provide some information, so I don't know if Doctor or our emergency management personnel want to come up and give some words.
Good afternoon. I'm Dr. Hidalgo. I'm a pediatrician, been in town for 30-some years, and the most important thing I think of Manny and all the council members and also as a community that we've been treating each other like a family, and basically it is very crucial that we continue this type of communication among ourselves so that we can basically have different ideas and then being together to provide whatever the seniors mainly needs, and also for the pediatric part. I'm a pediatrician, and for the pediatric side, what I've been doing basically is teaching the kids the basic stuff. Staying away from other kids that are sneezing, since we know that it is the droplets of the saliva and things like that goes around. The coronavirus is a big molecule. It's not a small, tiny, petite thing, so it stays in the surface for a while. So what I'm trying to do with the kids is basically teaching, when they sneeze, if they don't have a napkin or anything, just teaching them a simple thing as to just covering themselves how they sneeze, to sneeze inside like this, those kind of things. And again, there's a lot of the kids that I've seen today and all these days, there's a lot of anxieties going around. So we have to be basically from the psychological standpoint. We know we have a pandemic. We know we're going to have a lot more people. We have a big issue when it comes to, for example, in my office, I got 10 kids. That's all I have. I mean, I called the laboratory, and they said, look, I'm only going to send you 10 examination kits for the coronavirus. What are you going to do with that? We got 33,000 people in this home, which is Miami Lakes, for all of us. So we got 33,000 people getting 10 kits. And then the other issue, obviously, is before we actually do a test, we need to do the flu test, and we have a lot of influenza A, influenza B in the community. We already have over 18,000 people that passed away from influenza from September to now, and 130 kids. So we have to be, the anxiety level is important, that we talk to our kids, and, teaching how not to be touching things and to staying away and sneezing properly, those kind of things. But the psychological aspect of pediatric, it's important. And, and I think what the job the mayor's doing, and all of us guys, we've been here twice already, and we'll be here. It's very important that we continue to communicate, and as needs comes, like you were saying, basically, with the nursing home, it's important that we keep communicating to pass this through, so this will be part of our past, and we'll keep Miami Lakes the way it's always been, like a big family. Any question for me at all, you can ask.
All right. I think there was somebody that had a question.
Thank you. I want to thank the town officials and everybody here. I know there's a lot of fear right now,
Yeah.
and all this information really helps to quell those fears. I'm part of the Neighborhood Improvement Committee, and there's a lot of committees in town that would be willing, that's manpower for you guys. If you need anything, let us know. And from making phone calls to whatever you guys need, I'm sure every member of every committee in this town will be willing to step up and do what they have to do. So you can count on at least our committee, and I'm sure everybody will step up. So if you need the manpower, you have it. So and what you said, Doctor, is true. We're a family here, so
Right.
everybody is willing to step up.
That's crucial.
Thank you so much for
Sure.
everything. Appreciate that.
Mr. Mayor.
Chris? Yes, sir. You want to say it? Yeah. Good afternoon. I'm Lieutenant Garcia, Station 1 here in Miami Lakes with MDFR. I'm also a resident here in the town. I've had a lot of concerns, a lot of people, just when I'm running my 911 calls today, and they're asking me, hey, they're not so worried about themselves, believe it or not, they're worried about us. And like if there's an exposure and you need to be quarantined, we have a contingency plan where, yes, just like you guys, we're vulnerable. We go on a quarantine plan for 14 days, just like everyone else. But we do have a plan, a telehealth plan established, so when people call 911, they try to gather as much information as possible. It's very, very important. It's key that the exact information, signs and symptoms, whatever could be given to that 911 call taker is expressed in great detail, because that'll be passed to us, and we could wear the proper protective equipment we need in order to treat the patient, let the hospital know what we have and what we expect. But in the future, if we do get overwhelmed, we have that telehealth system where we could screen the calls over the phone. We could put you on with either a doctor or a PA, and we could possibly start running our 911 calls from remotely. So like that, everybody's not exposed. And we have some kind of barrier between the residents and the first responders in the community. Any questions about that? We're good?
So I know we're going to be setting up our command structure here while this is going on. There's going to be Mr. Manager, the phone number is going to be the regular phone number for Town Hall, 305-364-6100. So if everybody needs the phone number to City Hall, 305-364-6100, 305-364-6100. And we have a website in the town, miamilakes-fl.gov/coronavirus. And the health department's number is 305.
324-2400.
324-2400. We're all in this together. We're going to surpass this together. But again, reach out to us. I know there's a lot of concerns. I see my gym here. I see the folks from the Optimist, from the flag football, from baseball, you name it. There's a lot I know Jim's been working on the basketball program for the summer, and all that stuff right now is in limbo, but we want to work together to make sure we get past this as soon as possible. But not only that, get to those seniors, get to those families of folks that are vulnerable in our community as soon as possible. Mr. Manager, are you going to be setting up a command structure here at Town Hall, or you want to talk about that?
Yeah, we have, we're considering this as an emergency, right? That's why we're all here. That's why we've been talking about it all this time. So to react to emergencies, there's an incident command system that we have in place. There's an incident commander. We already have a hierarchy built in within our system, and we have that in place. I mentioned earlier that one of the things that we talk about is emergency operations the activation level. There's 3 levels. Level 3 is the simplest one, which is monitoring. That's where we're at right now. Level 2 would be if we have to actually activate this room, which acts as our emergency operations center, and then level 2 would be a partial activation. Not everybody in our operation would be needed, but then a full activation would be a level 1, and we're nowhere near that, okay? But we are taking the preliminary measures to build up to that if needed, and hopefully we never get there. But we do have a hierarchy in place. All operations for the town ultimately fall on my lap. I'm the town manager. Tony Lopez is our deputy town manager. He and I work hand in hand to manage the operations of the town, and we've got it developed. Tomorrow we're going to have a staff meeting, a briefing for our entire staff, because obviously without our staff, there's nothing. Tony and I, we're nothing without the people who do most of the work, right? So tomorrow we're going to have a staff meeting. We're going to talk to them about all the protective measures they should be taking in their personal lives at home and so forth. We're going to make sure that their understanding of what their expectation is here. We want to give them an opportunity to express any concerns or anxieties that they may have. So tomorrow we're going to make sure our staff, which is our #1 asset, is in full force, and their minds and their hearts are ready to go. And if they have any issues, we want to make sure that we take care of them first, because if they're not ready, they can't help any residents. So we have an operation, we got it well organized, and we have it set up, and our staff will be ready to go, and we're ready.
So we're going to get through this together. We're going to work. We're going to make sure that we work with you guys. Any other questions, comments? Yes, sir. Let me get to the microphone, because
Good afternoon. We're from the My Gym in Main Street. Obviously, our business is very related to schools. So that's my question. What about schools? What are the plans? Would that happen by individual schools? Should there be, God forbid, but should there be any cases related to a school that will force to close the schools, or would that be done by the town? Is there a guideline of how this could happen? It has happened in other locations in the United States already.
So as of right now, schools are not going to be closing. The school district announced it recently. I got a phone call from the chair. She actually is a resident. Chair Hatman is a resident of the town. Schools won't be closing at this point, but doesn't mean that they won't close next week, right? So we know that there's school tomorrow, but they have made an announcement that currently they have no plans to close, but if anything changes. But it'll be a district-wide closure. They won't be closing, meaning the entire Dade County will close if the district announces. There won't be one school here, one school there, if they were to do that, so.
Okay. And that would work the same for preschoolers?
That's different. So preschool managed by Miami-Dade County Public Schools, the public school system does it. Any other types of preschools, you'll see, I guess the health department will get involved.
Yeah, the majority of the private, parochial, charter school, most of them, in a situation like this, similar if there was an approaching hurricane, most of them take their guidance from the school board. So if the school board has a district-wide closure, the majority, I'm not saying 100%, the majority of the private or charter or parochial schools, they all follow the lead of the school board. So if you see an announcement from the school board that either that they're going to stay in session or that at some point they make a decision to close their schools, the majority of the private, charter, parochial, they'll follow their lead. That's been the history, and that's what we expect will happen.
Thank you.
Thank you. Any further questions, comments, concerns? Everybody, we're all on the same page. Just remember, don't panic, but simply follow instructions. Prevention, prevention, prevention. We will get past this, but follow those instructions set forth by the health department, by the CDC. Forget about what they're saying on social media, everywhere else. The real information is on the websites they provided, and we're all in this together. Call us here at Town Hall, 305-364-6100. And after hours, I know you can call our police department also. Do you want to share that phone number, Mr. Major? 911, obviously, for a major emergency, but for non-emergencies or something that you just want to ask a question on, even if it's midnight, we do have a phone number you can call.
Correct. If you have any concerns that you like to talk to one of our town supervisors, one of the town sergeants, you can always contact 305-525-6678. Obviously, if it's something that you require police presence, then call 911 or call the non-emergency number if police have to respond, because those phone numbers are monitored, they're recorded, and they're manned 24/7. The non-emergency number is 305-4-POLICE or 305-476-5423. The town sergeant cell phone is 305-525-6678, and that phone number is in case you want to discuss a concern. Sometimes the sergeant is out of the car assisting officers, or they're handling something else, or they're handling a call. So again, if you require police to respond right away, call 911 or the non-emergency number. But if you need to discuss a situation in detail or a concern that you guys see, something that we should check out, or a concern with anybody in the community, please feel free to give us a call. Thank you.
Of course. All right, guys, I think we're good. Let's keep working together. Prevention, prevention, prevention. I know we keep talking about that, but that's the main thing. Little things like sanitizing your phone, right? Nobody talks about that, but you shake somebody's hand, you touch your phone, you wash your hands, but you never clean your phone. So sanitize your phone, sanitize surfaces. The virus, what we've heard is easily, you all, they're epidemiologists, but they're easily killed as long as you sanitize the surfaces. And keep up the good work in your facilities. Any questions that you have, please reach out. And yes, I see another.
I know we cancel all the games, but can the kids practice?
Yes.
The practice,
Not yeah, they can. The parks will be open. People can go to the parks and play. There won't be organized town practices though. So, am I correct, Mr. Manager?
Yes, the fields, they'll all remain open. So informal practices, we're not going to have scheduled games. We're not going to have those all those activities are the ones that we've canceled now. So if coach wants to go with some of their players and take a corner of the park and do some kind of a practice, the fields will still remain open. So whatever the normal MO and the normal practice has been, at least when I was coaching my son, we just, there weren't field assignments. You just practice wherever you could practice and find a spot, batting cages, everything. So that will continue. We just won't have any games and organized activities.
Okay, thank you.
All right, guys, thank you very much. If you have any questions that you want to ask in private to the health department or the first responders or anything in private, you guys are more than welcome to. They'll be hanging out here for a little bit longer. God bless you guys. Reach out to us. We're in this together, and we'll definitely get past this together. God bless you guys.